Women with CHD who are considered high hazard by routine measures are more likely to have safe and healthy pregnancies, a new research finds. The Perelman School of Medicine at the University of Pennsylvania reveals that their findings are extremely promising for women with CHD who are entering their child-rearing years, but now, there is a better chance of a healthy and low-risk pregnancy. What is CHD? Congenital heart disease, a group of abnormalities in the heart that develop before birth, including holes in the heart, leaky or narrow valves, and incomplete or missing parts. Early in their lives, these children frequently experience various cardiovascular surgeries to repair their hearts, and must be administered to by a cardiologist for whatever remains of their lives. The researchers examined 186 women over 18 with CHD who had conceived an offspring somewhere around 1998 and 2014, and connected hazard scores from CARPRUG and Zahara, and doled out altered WHO criteria to every patient. Cardiac events, for example, arrhythmia, heart disappointment, stroke, heart assault, heart failure, or cardiovascular demise, were evaluated for up to 6 months after birth. There were 31 heart occasions, speaking to 17% of all pregnancies, yet none of the women died. With the CARPRUG model, the evaluated chance versus watched unfriendly occasions varied incredibly from 75 to 25%, and with Zahara, assessed hazard was 70% and watched occasions were 38%. The CARPRUG study, a vast planned study crosswise over 13 focuses in Canada, assessed 599 pregnancies that finished in a live birth, to decide and approve a hazard score. One indicate was given each of the 5 distinguished hazard components, including earlier signs of heart disappointment, stroke before pregnancy, or arrhythmias, and a cardiovascular occasion rate was figured by aggregate number collected. The other tool currently used, Zahara, originates from Multicent Registry in the Netherlands and Belgium, which analyzed 1,302 pregnancies in 714 women, which likewise finished in live birth. 8 hazard components were recognized to foresee heart confusions amid pregnancy, and Zahara allocated indicates from 0-13 to every variable with a higher aggregate likening to a higher risk of cardiac complication. Conversely, the changed WHO criteria doled out a hazard score to the patient from 1 to 4, in light of the mother's level of basic CHD, history of repair and clinical status. Anyway, the outcomes from this study will absolutely be useful in consoling lady with CHD that most patients in comparable circumstances have effective pregnancy, particularly on the off chance that they are overseen in a high chance center.